We've all heard the term morning sickness. It's so common, it's almost treated like a rite of passage in pregnancy, right? Just an unpleasant but normal thing to get through. But what happens when it's not just a passing wave of nausea? What if it becomes something so severe it completely takes over your life? Well, that's exactly what we're going to dive into today. This is the big question, isn't it? Morning sickness or something more? And honestly, the answer can make all the difference in the world. So, using our source material, we're going to explore the whole spectrum, from that common discomfort all the way to a really serious illness, and figure out the critical signs that tell them apart. So, here's our game plan for this explainer. First, we'll cover the basics of what everyone calls morning sickness. Then, we'll look at when that sickness becomes severe. After that, we'll dig into the possible causes, see how doctors tell the difference, and finally, we'll walk through the different paths to recovery and management.
All right, let's start at square one. We need to establish a baseline. Let's talk about what's medically known as nausea and vomiting in pregnancy, or NVP for short.
According to our source, NVP is actually the most common complication of early pregnancy. But here's the first thing you need to know. That name, morning sickness, is kind of misleading. It's a total misnomer, because for a lot of people, it can hit you morning, noon, or night. So just how common are we talking about here? Well, our source material says that about half, 50%, of all pregnancies involve at least some vomiting. It's so incredibly prevalent that it's often just seen as a standard expected symptom. But this is where the story changes. For some people, this common sickness, it evolves. It turns into something way more severe. And this is where we need to introduce a condition called hyperemesis gravidarum, or HG. Okay, this slide really lays out the critical difference. On one hand, you have NVP, which is uncomfortable, sure, but generally manageable. On the other hand, you have HG, which is defined by how it negatively impacts your health and literally incapacitates you. This is not just bad morning sickness, it's a completely different and serious diagnosis. And this number you're looking at, this is a huge diagnostic marker. When the nausea and vomiting get so bad that a person loses more than 5% of their pre-pregnancy body weight, well, that's a major red flag and a key indicator for hyperemesis gravidarum. And this chart just puts it all into perspective visually. I mean, look at that. While a huge chunk of pregnancies, maybe up to 80%, might have some NVP, true hyperemesis gravidarum is thankfully much, much rarer. We're talking about 1 to 3% of pregnancies. So, of course, this leads to the big question. Why? Why does this happen? Let's take a look at what the research says about what's going on behind the scenes with both NVP and the more severe HG. Our source text makes a really important clarification here. The potential causes of vomiting during pregnancy get split into two main buckets. Some are directly related to the pregnancy itself, like NVP and HG, but others are just associated with it, meaning there are other medical issues that just happen to pop up at the same time. As for the causes that are directly related to pregnancy, science has a bunch of theories. The one that's getting a lot of attention right now involves a hypersensitivity to a hormone called GDF15. But there are others too, like really high levels of the pregnancy hormone HCG, psychological factors, not getting enough of certain nutrients, and even your digestive system just slowing right down. But this quote from our source really hits the nail on the head. The etiology is obscure. What that means is, even with all these strong theories and known risk factors, like if it's your first pregnancy or you have a history of motion sickness, the exact single cause of HG is still something of a mystery to medical science. Okay, so if the cause is still a little bit murky, how do doctors make a confident diagnosis? Let's walk through how they can tell the difference and identify hyperemesis gravidarum for what it is. So it often starts with just a physical exam, where a doctor is looking for some really clear signs of dehydration and starvation. We're talking things you can see and measure: a dry, coated tongue, sunken eyes, a specific acetone smell on the breath, even a super fast heart rate or low blood pressure. All these things are screaming that the body is in serious distress. And of course, it goes beyond just a physical exam. Specific tests are absolutely crucial. Blood work can show if electrolytes are out of whack or if the blood is too concentrated, a clear sign of dehydration. A urine test can check for something called ketones, which confirms the body's in starvation mode. And then an ultrasound is used to confirm the pregnancy is where it should be and rule out any other issues causing the severe vomiting. So, once that diagnosis is made, what's next? What's the path to recovery look like?
In our last section here, we're going to look at how both the mild NVP and the severe HG are managed.
Okay, for the milder cases of NVP, management usually starts with some pretty simple conservative stuff. Things like nibbling on dried toast or crackers before you even get out of bed, steering clear of greasy and spicy foods, drinking fluids between meals instead of with them, and sometimes supplementing with vitamin B6 can really help. But for HG, those simple measures just aren't going to cut it. The approach has to be way more aggressive. Medication is usually the answer, and it follows this tiered strategy. Doctors will start with first-line drugs like antihistamines. If those don't work, they escalate to second-line options. And in the most severe cases that don't respond to anything else, they might even consider corticosteroids. For severe HG, hospitalization is often necessary. And the main goal here is to give the digestive system a complete break. By using IV fluids, doctors can rehydrate the patient, correct dangerous electrolyte imbalances, and fix any metabolic issues, all without them having to swallow a single thing. And this aggressive management is so important because untreated HG can lead to some rare but incredibly serious complications for the mother. We're talking about neurological problems from vitamin deficiencies, tears in the esophagus from violent vomiting, and the profound psychological toll, like severe depression. But what about the baby? That's the question everyone asks, right? Well, the good news is that the fetus is often completely fine, especially once the mother's condition is stabilized. However, our source material does point out that severe, poorly managed HG carries about a 10% increased risk of the baby being born with a low birth weight or arriving a bit too early. And that brings us to our final thought. We've gone through the medical side of things, from the diagnosis to the IV drips, but it leaves us with a much bigger question. Knowing just how isolating and draining this condition can be, how can we as friends, family, and as a society do a better job of supporting people who are going through the immense physical and emotional challenge of hyperemesis gravidarum? Thank you so much for joining me for this explainer. I really hope this look into the source material has given you a much clearer picture of the whole spectrum of nausea and vomiting in pregnancy.